Let me begin with a question that many men over 50 quietly think about, but rarely feel comfortable discussing openly. If you're past 50, how often should you actually ejaculate to support and protect your prostate health? Is there an ideal number? Is more always better? Or could both too little and too much potentially work against you over time? If this question has ever crossed your mind, you're certainly not alone. In clinical practice, it's one of the most common and quietly asked concerns among men in their 50s, 60s, and even 70s. Unfortunately, when people search for answers online, they often encounter extreme viewpoints, some claiming daily ejaculation is a cure-all, while others warn that sexual activity is harmful or draining at this stage of life. The truth, as is often the case in medicine, lies somewhere in the middle. Today, we're going to explore this topic calmly, clearly, and without judgment. We'll look at what scientific research actually suggests about ejaculation frequency and prostate health after 50. We'll also discuss what changes biologically as men age, the potential benefits, the possible downsides, and most importantly, how to determine what frequency truly supports your individual body. By the end, you'll have guidance grounded in physiology and real-world experience, not myths, pressure, or unrealistic expectations. Understanding what changes. After 50. To understand the role of ejaculation, we first need to understand what's happening inside the body after 50. Testosterone levels gradually decline with age. This doesn't happen overnight, but over time, it can affect energy levels, libido, muscle mass, and recovery. Blood vessels may become less elastic, which can influence circulation and erectile quality. The prostate gland itself often enlarges, a condition known as benign prostatic hyperplasia, BPH. This enlargement is extremely common and does not mean cancer. By age 60, about half of all men experience some degree of prostate enlargement. With that can come urinary changes such as a weaker stream, more frequent urination, especially at night, and the feeling of incomplete bladder emptying. These changes are part of normal aging, but they also make men more aware of their prostate health and naturally lead to questions about ejaculation. Potential benefit. Number 1. Prostate fluid clearance. The prostate produces seminal fluid, which is released during ejaculation. Some research suggests that regular ejaculation may help clear out inflammatory substances and prevent stagnation within the gland. A well-known long-term study followed over 30,000 men for nearly 2 decades. It found that men who ejaculated more frequently, around 21 times per month, had a lower risk of developing prostate cancer compared to those who ejaculated less often. Biologically, the theory is that regular emptying may reduce cellular stress and inflammation in the prostate. Practically, this offers reassurance that sexual activity may play a supportive role in long-term prostate health. However, it's important to understand this is an association, not a strict prescription. It doesn't mean every man needs to aim for a specific number. Potential benefit number 2. Improved pelvic circulation. Erection and ejaculation increase blood flow to the pelvic region. This enhanced circulation helps deliver oxygen and nutrients to tissues, supporting both prostate and erectile health. Think of it as a form of gentle vascular exercise for the pelvic area. As cardiovascular risks increase with age, maintaining good blood flow becomes even more important. Many men also report that maintaining sexual activity helps preserve responsiveness and confidence, which contributes to overall well-being. Potential benefit number 3. Hormonal and stress balance. After ejaculation, the body releases a cascade of hormones, including prolactin, oxytocin, and endorphins. These chemicals promote relaxation and shift the nervous system into a calmer, parasympathetic state. This can help reduce stress hormones like cortisol, improve sleep quality, and create a sense of emotional balance. For men dealing with midlife stress, work pressures, or sleep disturbances, this effect can be particularly valuable. Finding balance, when more isn't always better. While there are benefits, balance is essential. Drawback: for 1, fatigue and recovery limits. As the body ages, recovery takes longer. Testosterone replenishment may not be as rapid as it once was. If ejaculation becomes too frequent without adequate rest, nutrition, and physical activity, some men report feeling drained or fatigued. The key signal to watch is how you feel afterward. If you feel energized and balanced, your frequency is likely appropriate. If you consistently feel depleted, it may be too much for your current capacity. Drawback number 2, ignoring symptoms. Some men assume that regular ejaculation protects them completely, leading them to ignore urinary symptoms or pelvic discomfort. This can be risky. Ejaculation does not eliminate the need for medical checkups, prostate screenings, or PSA testing. Persistent symptoms should always be evaluated by a healthcare professional. Drawback number 3, compulsive patterns. If sexual activity becomes driven by stress, boredom, or habit rather than intention or connection, it may create an unhealthy pattern. Over time, this can affect mental well-being and even reduce sensitivity. A useful question to ask is, am I choosing this or is it choosing me? So, what's the ideal frequency? For most healthy men over 50, a moderate range, typically 2 to 5 times per week, is well tolerated and beneficial. This range supports circulation, prostate function, and hormonal balance without overwhelming recovery. However, this is not a rigid rule. Individual factors matter. A physically active 52-year-old may feel great with more frequent activity. A 68-year-old managing diabetes or hypertension may feel better with less frequent activity. Your body provides feedback, you just need to listen. Practical self-check. Questions: instead of focusing on numbers alone, ask yourself, do I feel energized or drained afterward? Is my sleep improving or worsening? Are my urinary symptoms stable or changing? Does this feel intentional and positive? These answers are far more valuable than any fixed number. The bigger picture: lifestyle matters. More prostate health is not determined by ejaculation frequency alone. It's closely tied to overall metabolic health. Factors that strongly influence prostate health include maintaining a healthy weight, regular physical activity, managing blood sugar and insulin levels, getting quality sleep, reducing chronic inflammation, limiting alcohol intake, eating a fiber-rich, balanced diet. Ejaculation is just one piece of a much larger puzzle. Final thoughts. The bottom line is simple. For most men over 50, regular ejaculation is safe and may even provide meaningful benefits. But more is not always better, and less is not necessarily harmful. The right frequency is the one that supports your energy, recovery, relationships, and long-term health goals. Awareness matters more than counting. Balance matters more than pressure. And intention matters more than habit. Your body is adaptable. Your prostate is not fragile. It responds to lifestyle, circulation, and overall health. Keep moving. Sleep well, eat wisely, stay connected with your partner, your body, and your physician. Because sexual health is not separate from overall health, it's a vital part of it.